Hi, welcome to Medicare Show. I'm your host, the Medicare advisor, Jeffrey Kuhn. In this episode, I'm going to be talking about in detail Medicare's new rules with the Inflation Reduction Act around Part D, the elimination of the infamous donut hole, which has been called the coverage gap, and the introduction to a $2,000 out-of-pocket max with a prescription payment program that's going to be available for everybody in 2025. In this podcast, it started with a lot of conversation. I talked to a lot of people in the industry about what's happening and how we're going to handle folks for 2025 when it comes to this and how things are calculated. And we know human nature and what people do and how they select plans. Two things people take into consideration when you're looking at Part D plans, and that's really applies to most people are in Medicare supplemental, or it's also called a Medigap plan. They've noticed the first thing that everybody's starting to chat about, they've gotten their annual notices of change, and people are pretty outraged. Their premiums have gone up. The cheapest plan in my area has gone up 1,000%. And I was reading an article, I think it came out last week on Reuters News, they quoted Medicare stating that Part D premiums and Advantage plan premiums were going to go down in 25. And most of the news I'm going to tell you is politically driven. And that piece of information, I decided to challenge. I ran all the Part D plans, certainly in my area. And I printed them out for 2024 and laid down 25 next to them. And I wanted to find one prescription drug plan that actually went down in its cost. Couldn't find it. So I said, okay, let me look at them all and see if any of them have actually stayed the same without even looking at the benefits. Saying, is there an improvement in benefits or reduction in benefits? Premium-wise, based on the statement, not one stayed the same. Every single one of them went up, and it went up a lot. And people are getting a real rude awakening about their premiums for next year. Things are already expensive enough, but their drug plans are going up. And that's mostly due to one of several factors, one of those being that the insurance company now has to pay 5% of what people used to pay in catastrophic coverage. So a lot of the costs are getting passed down. Ultimately, the consumer is going to pay. Now, there are a handful of people that will benefit. They're on very expensive prescriptions. I'm going to get into that shortly. But when people see, well, my premium's going up, what do? You start looking and shopping and saying, well, I'm going to take a look and find a cheaper drug plan. There's a couple of things you'll want to know about 2025 in regards to this $2,000 out-of-pocket max. You better make sure that your prescriptions are in formulary with whatever drug plan you choose, or they do not count. So if they're not in your prescription's formulary, your insurance company also has not given you an exception to cover them, and those are usually the expensive ones. They're not going to count towards your $2,000 out-of-pocket max. So when you're looking at just deductible, you're not looking at everything. There's a lot you need to take into consideration. A lot of insurance companies have raised deductibles. They've changed copay, co-insurance levels, and that's going to have an impact on what you're going to pay out of pocket. There's going to be some people that are going to decide that they're going to go with a higher deductible. And believe it or not, a lot of those plans are going to pay less money over the course of the year for their prescriptions. They're going to pay less than the $2,000 out-of-pocket max. That is possible. And I'm going to tell you in this podcast how that's done and calculated. First, let's discuss Medicare's base level structure for Part D plans for 2025. Medicare's come out and announced that $590 is the deductible for prescriptions. So you can charge up to a $590 deductible, not over that. Also, 25% of your drug costs is what the insurance companies can charge, up to a max of $2,000 out of pocket. Now, that's important to know. Why? Because you could be in a prescription drug plan. It could be within an Advantage plan, a Part C. That means your Part D is included. Or it could be a standalone Part D plan. When you're looking at just the deductible and you're not taking other things into consideration, you may end up paying $2,000 out of pocket, but there's an opportunity to not pay $2,000 out of pocket. And usually that comes in around your tier 3s. With most insurance companies, we typically see a $40-some copay. I'm going to say something that's in the $40-some range. And it comes with a deductible. So if you have a tier 3 or higher, you pay your deductible once for the year, and then you pay copays. What's going to happen, we're seeing some of the insurance companies are taking copays that they used to have in place, and they're going to co-insurance. Now, this could work for you, or it could hurt you. And here's why. Let's just assume you've got a prescription. It's a tier 3 medication. You paid a deductible on it. That full deductible counts towards your max out-of-pocket cost. And let's say you've got a copay, $42, $44, $47, whatever it may be. And let's just assume you've got a prescription. Let's just round it up. Typically, they cost a little less. Sometimes they don't. They could cost more. But let's say for simple math, your prescription is $1,000. That's the retail price of it. Not what the insurance company pays, not what you pay, but that's the actual retail price at whatever retail location you're getting. So you've got an option. You got one plan that charges a deductible, counts 100% towards your out-of-pocket max, and has a $40-some copay. Now, that $1,000 prescription, what actually counts towards your $2,000 out-of-pocket max? Well, it depends. If just looking at straight Medicare, they allow 25% of that cost will automatically count. So that's $250. Let's say that you've got a tier 3 level copay of $40-some. So even though you've got $40-some you're paying out of pocket, you're actually getting a full credit of the $250. The 25% that is allowable by Medicare, that actually counts towards your out-of-pocket cost. Let's say you're baited into a cheap plan that doesn't have a deductible, and you got 50% coinsurance on tier 3s. Well, in a $1,000 prescription, your friend just bought it, let's say, for $40-some, you're going to get that script filled, and you're going to pay $500, 50%. So your out of pocket is 50%, $500. Your friend got it for $40-some and got a credit $250. You're going to reach your out of pocket max quicker, but you're also going to pay more out of pocket than someone else might. So you got to be really careful, especially when you're looking at retail price copays versus coinsurance. I just looked at one of the pretty popular plans. It's an Advantage plan, and I've got clients that are on the Omnipods. So we're trying to figure out what's the best way to go about tackling this, because they're paying a fortune for them. Those Omnipods are pretty expensive. Most of the people on them are in the coverage gap, and at 25% of the cost share, they're paying about $550 out of pocket per month at 25%. So an Omnipod, you're going to hit your out-of-pocket max pretty quick. But what I'm trying to determine, is there a way to save money in that? One of the, and I looked at one of the most common Advantage plans, and what I noticed is next year it's a tier 4, and that tier 4 prescription is going to have a 50% coinsurance on that, which tells me with a deductible, the client's going to hit the out-of-pocket max pretty quick, but we're not going to be able to stay below the 25% troop expense that's allowed by Medicare. But the law of prescriptions there are. I mean, it's a pretty complicated way of figuring out how to spend less than the max $2,000. And again, one of the things with the prescription payment program, keep in mind for next year, even if you're in the most expensive prescriptions, what you're really looking at is a max of about $167 out of pocket per month. But if you want to try to take advantage of the troop expenses, you got to look at the details of the drug plans that are available. You've got to understand, deductible isn't everything. It's really where the tiers of the drugs are assigning coinsurance versus copays. That's where you're going to win or lose in 25. And it may make the difference between you paying out the full $2,000 and somebody else that doesn't. They're going to get figured out, and they're going to pay less based on the prescription overall picture of managing their scripts. Work with somebody that understands this, that knows this. Don't go into messaging boards, like I said in my last podcast, and get a lot of misinformation. It's a lot more complicated than people understand. But the good news is for people that are paying a lot out of pocket with the coverage gap, infamous donut hole this year, you're going to pay a max of $2,000. But there's the important thing is for a lot of people, there's an opportunity to pay less than that based on how you're getting your prescriptions and how you choose your drug plan. So choose smartly, choose wisely. There's a lot of choices. Take your time and understand it. And again, talk to somebody local that can help you, or an expert that understands the Part D plans, Advantage plans, which are called Part C, that include your Part D in them. And they should be able to help you, or give us a call directly. We should be able to help you figure that out. Hope you're all doing well and hope this information was helpful. Please subscribe to this podcast. Share it with anybody you know that's evaluating plans. I'm sure they're going to find this information helpful. Thank you. Good night.